On the 11th of January, the Care Quality Commission published the results of their 2022 maternity survey, which includes feedback from nearly 46,000 mothers across 121 NHS trusts. The survey asked patients about their experience in 3 areas of our maternity services: antenatal care, labour and birth, and postnatal care. I asked Sally Brittain, Director of Midwifery at Royal Cornwall Hospitals, how did we do?
We did really well, and we're absolutely delighted that a lot of our results were extremely positive. There was a real focus on improvement around information giving, choice for women and their families, and women and families being involved in the decisions that affected them during their antenatal period and during their labour and delivery. We were really pleased that they also reported being treated with respect and dignity, and that they had trust and confidence in those clinicians caring for them. We've been working really hard in these areas over the last few years, so we're really delighted to see that there's been such an improvement. In fact, such an improvement to the extent of care around the start of your pregnancy. We were ranked as the best trust in the country, which is phenomenal. We were ranked 4th in the country for care during your pregnancy and 7th for antenatal checks. All of those areas put us in the somewhat better or much better than expected.
In fact, I don't think we heard from anybody that our services were worse than they expected. They were all really positive.
They were. So the questions for the categories are worse than expected, somewhat worse than expected, about the same, much better, those sorts of things. And we had questions in the about the same as all the other trusts in the country, but none in the worse or somewhat worse.
We should be really proud of our results this year. What can we do next year to make our results even better for our patients?
Well, what we did get from this survey was things that we actually already knew, that there is an area for improvement around our postnatal services. That wasn't a surprise to us at all. We've been working really hard with our Maternity Voices partnership in Cornwall, and they have come in recently and done a 15 steps inspection for us. And that highlighted the same things actually that were highlighted in this response now. So that's going to be our main area of focus. We're going to have a very big joint piece of work with our MVP to make sure that we're really focusing on those areas to get them right for the next survey.
And what do you think these results mean for the people of Cornwall?
I think that they mean that the families who use our services can have confidence in the care that's provided, and they can really think about the fact that they can use the information they're given and the trust they have in us to really ask questions about what they want from their care. And the other thing the survey does demonstrate is that there's a lot of choice. So I would urge women to talk openly to their midwife, to their obstetrician, and really plan the care that they want during their pregnancy and birth.